Jenny is a 30-year-old female who visited her physician complaining of abdominal pain, fatigue, diarrhea, and weight loss. She says she notices these symptoms specifically when she eats food that contains gluten. Jenny states that her mother has celiac disease. The physician decides to look into celiac disease as a possible diagnosis.
Protein digestion starts in the stomach and is broken down further in the small intestine by pancreatic enzymes such as trypsin, chymotrypsin, carboxypeptidase, and elastase. Trypsinogen is activated by an enzyme located on brush border cells of the duodenal enterocytes. When trypsin is activated, it triggers more molecules of trypsinogen to be stimulated. The amino acids are then linked on the surface of the intestine mucosa by brush border enzymes. The amino acids are then broken down into 1 to 3 amino acid chains and are transported across the mucosal membrane in a sodium pump process that uses ATP. Some amino acids are transported by carrier-mediated facilitated diffusion. The enzymes involved in this digestive process are proteins. Mucosal cell membranes are involved with the amino acid absorption.
Celiac disease is speculated to be an autoimmune response to gluten characterized by the inflammation and loss of villi in the small intestine. Wheat, rye, and barley are sources of gluten. Alpha-glandin is the protein component found in foods that contain gluten. When a person with celiac disease ingests gluten, the small intestine becomes inflamed. Inflammatory chemicals are released into the ECF by injured tissues. Mast cells release histamines, a major inflammatory chemical, which is a protein. Macrophages have cell membrane receptors that recognize invaders and sound an alarm. The surface cell membrane receptors are called toll-like receptors, and they play a role in triggering the immune response. This inflammatory response in the small intestine leads to the destruction of the villi, therefore causing improper absorption of nutrients, creating symptoms of abdominal pain, diarrhea, weight loss, and fatigue. Risk factors for celiac disease. Almost everyone with celiac disease has the histocompatibility complex class II allele HLA-DQ2 or HLA-DQ8. If one of your parents has this disease, you have a 1 in 10 chance of developing it.
Although there is no traditional treatment for celiac disease, to help prevent the symptoms and long-term effects, it is recommended to follow a gluten-free celiac diet. Due to lack of nutrient absorption, it is also encouraged for people with celiac disease to include multivitamins, particularly iron and calcium, in their daily regime. Homeostatic balance in the body is disrupted due to the damage of the villi in the small intestine. This prevents the proper absorption of nutrients that the body requires to maintain homeostasis.
The physician performed a scope of Jenny's small intestine and found that there was inflammation and flattened villi. The physician also suspects that Jenny has the HLA-DQ2 allele and that she inherited the disease from her mother. Jenny is going to follow a strict gluten-free diet and take calcium, iron, and multivitamin supplements to manage her symptoms.